Good day, everyone. Today we'll be discussing a bothersome disease that affects a lot of people, adults as well as children, as statistics have shown. With me today is Dr. Aretha Liwag, an endocrinologist who trained at the Philippine General Hospital. Join us as we talk more about this disease so that you'll be more proactive and conscious in monitoring your health. I am Dr. Ramones Guerra Jr., your host, only here on Health Watch. Our guest today is Dr. Aretha Liwag, an endocrinologist, a diabetologist who trained at the Philippine General Hospital. She'll be discussing to us the pathophysiology of diabetes, complications, and the prevention of this disease. Good day, Dr. Liwag.
Good day, Dr. Guerra. Good day sa televiewers. Thank you for inviting me in your program, Health Watch.
May I ask you, Dr. Liwag, how do we get diabetes? And how would this affect our body?
So, just like any Facebook status, it's complicated. So, diabetes for me is a natural progression of what we call modernization of civilization and society. So, maybe we can go back and review what has been happening to everybody for the past how many years. So, our diet, our traditional Filipino diet and way of life has changed so much in the past few years. So previously, we have eaten our traditional Filipino food. Now, we see more of what we call Western food. We consume it every day. So this kind of food is so much laden in fat and oil, which contributes to developing diabetes. Our childhood was centered around our playing the traditional Filipino games. Now, most of our children sit and watch TV more than 8 hours a day on weekends. They have their own computers, laptops, iPads, all their gizmos, such that they just sit down and lead sedentary lives. So when we say sedentary, there's not much walking to school. During weekends, they don't play, ride bikes, swim, as we did when we were in the probinsya, when we were growing up. So this and our food choices lead to such diseases that we call lifestyle and chronic diseases. Now, what does diabetes bring about in our lives and in our health? So diabetes affects our pancreas. So this is what we call balabag in Ilonggo. I'm not so sure in the other dialects how they call it. But the effects of our lifestyle makes our pancreas secrete more or insulin, and in effect, as time goes by, the cells of the pancreas eventually die. And now, the pancreas cannot secrete the most important key that will make our body more efficient in taking care of all that sugar. Nawawala sa sistema ang insulin. Insulin is the key why sugar is being used in the body so that we can efficiently use it in our daily lives. So, if the insulin is depleted or nawawala ang insulin, sugar stays in our system. So this can lead to the manifestation of the patients na parating gutom. There's too much sugar in the body, but we cannot use it. So parating gutom ang pasyente. There's too much sugar such that the body will just have to wash it out through the urine. And that is why patients would report that they urinate often and sometimes they cannot sleep at night because of the frequent urination that happens. So after a while, these patients would report weight loss. So maski marami silang kinakain, maski parati silang uhaw, and that they drink water as much as they could or as frequently as they feel like it, the patients would still lose weight. So weight loss. They will feel, of course, since hindi nagagamit or the sugar is not being used by the system or the body, then nanghihina sila. They feel weak. Because of the too much sugar in the blood, these patients will now be prone to infections. So most of the time, these patients of ours, the diabetic patients, will come to our clinics consulting for infections like pneumonia and non-healing wound. Wound that does not heal for a long period of time. But this is also a misconception that even the diabetics, even if they have wounds, this heal almost normal compared to normal patients. So I tell also my patients that even if their wound heals as quickly as those who are normal, they might still be diabetic. So the more common signs and symptoms of a diabetic patient is parating nauuhaw or parating ginugutom, weight loss. These are the classic signs of diabetes.
Thank you very much, Dr. Liwag. In a short while, we'll be talking more misconceptions and how to treat and prevent this disease. Relax, stay in your seats, Health Watch will return. Most common misconception is if you get pricked and this wound will not heal because you have diabetes. Is this true? If a patient has diabetes, is it mandatory for them to undergo dialysis?
Oh, not really.
Welcome back. You're still watching Health Watch with me, Dr. Guerra and Dr. Aliwa. We have discussed a little bit about diabetes, as how it works, and right now we'll be talking some misconceptions, common misconceptions, and the treatment or things that we need to do in order to prevent diabetes. Doctora, the most common misconception is if you get pricked and this wound will not heal because you have diabetes. Is this true?
Actually, we have patients who would often tell that they're not diabetic because their wounds would heal immediately. Now, we would often tell our patients that it's natural. All our patients, or even diabetics, all their wound will heal immediately. We don't want that this wound will not heal because it is a reflection of how chronic, of how long they have been having diabetes. And once their wounds will not heal, it's because that most of the time, these patients already have complications. So it's a sign that their diabetes has already progressed. So for the newly diagnosed diabetics, they would still have wounds that will heal immediately.
Doctora, if a patient has diabetes, is it mandatory for them to undergo dialysis?
Oh, not really. For the newly diagnosed diabetics, most of the time, the only thing that is not normal in their laboratories will be their increased fasting plasma glucose. Most of their laboratory tests will reflect that they have normal kidney functions, normal liver functions. However, if they do have develop complications, that's the time that they will have abnormal kidney functions. But once the complications come in, then dialysis is a chronic complication of diabetes. Eventually, we see patients who had diabetes for the past 20 years, and that's the time when their kidney function becomes lower or tends to fail, and eventually they will have chronic dialysis.
When we return, we'll be giving you more tips to keep you and your family healthy. So stay tuned. Health Watch will be right back. If you're diagnosed to have diabetes, what will be the medications for this?
For diabetes, diet and exercise is still the mainstream.
You're still watching Health Watch here on Amazing Planet channel. We have talked a lot about diabetes, and now we'll be talking about how to avoid this disease and what to do when you have it. Dr. Liwag, what are the do's and don'ts on how to avoid diabetes?
Well, we go back to basic. What was our lifestyle before? So first, we'll have to look at how we do our daily activities. So let's walk more, exercise more. So you can still do that now. Instead of just going malling, then you need now to walk more often around the mall before you go into a department store and buy. How about the food? A lot of our food has a lot of fats. So it will be best if we could consciously choose the food that is less in fat. As much as possible, it will not be fried. Let's choose our food that has cooked with roasting, steamed, and mga sinabawan. Now, this with lots of vegetables and of course fruits. Let's consciously tell our children to go out and play more often, run in the yard, or be more active, take up sports. Let's be more conscious in decreasing the amount of time that we watch television or use our computers. Those are lifestyle changes that we will have to adopt.
So, Doctora, how do you know that you have diabetes?
Most of the time, diabetics will not have any symptoms. So for those who have a family member who has diabetes, if the parents have diabetes, or if your brothers or sisters have diabetes, then it's about time that you will have your fasting plasma or fasting blood glucose checked. If for women, if they had a history of delivering to babies 8 pounds and above, then they could be at risk of developing diabetes in the future. For those who have hypertension with increased cholesterol levels, be aware that hypercholesterol, hypertension, and blood glucose levels are the three best friends. They usually go together. So if you have one of the three, then you better have yourselves checked if you also have the risk for type 2 diabetes. For those who are aged 45 years old and above, even if you do not have the following conditions, you have to have yourselves screened for diabetes. So, and for those who have weight problems, they have more weight than is normally or is what is right for their height, then they also should have their fasting plasma glucose or fasting blood glucose levels checked.
If you're diagnosed to have diabetes, what will be the medications for this?
For diabetes, diet and exercise is still the mainstream or the traditional treatment for diabetes. We only give tablets if the patient's blood sugars are not controlled by the diet and the exercise. So we have a lot of tablets that we can give our patients. And for those who are very at risk of having uncontrolled blood glucose levels, we also give or prescribe insulin. Now, insulin is there to control your blood glucose levels. So it is one of the misconceptions also that if you are given by your doctor insulin, you already have an advanced disease. Most of the time, diabetic patients will really need small amounts of insulin so that they can have better blood glucose control. They will have better quality of life if they do be placed on insulin. It's not the end of the world. We readily give insulin to make our patients more comfortable.
If you are looking for a hospital that caters to your needs, the West Visayas State University Medical Center is one of the best that can provide you the services that you need. You can consult Dr. Liwag, the hospital, or you can visit her at her clinic. I'd like to thank Dr. Liwag for sharing with us her expertise about diabetes.
Thank you, Dr. Guerra. And for those viewers who would like to have themselves checked for diabetes, they could consult us here at the outpatient department of the West Visayas State University Medical Center. For those who would want to see me at my clinic, it's at JNB Building in Quezon Street. So thank you, Dr. Guerra, for giving me this opportunity to be with you today to discuss things about diabetes.
Thank you, Dr. Liwag. Our viewers, if you have a health concern that you would want us to discuss, drop us as a message on our Facebook. We'll be able to talk about it in our next episode. This has been your Dr. Ramon Guerra Jr. for Health Watch. And join us again next time, only here on Amazing Planet Channel.